Good morning. Today let us study about the oculomotor nerve, which is the third cranial nerve. This oculomotor nerve will discuss under the following headings: the introduction, the nucleus and functional components, course and branches, areas applied, and the applied importance. Coming to introduction, oculomotor nerve is the third cranial nerve. Oculo means eye, motor means movement of the eyeball. So the most of the extraocular muscles of the eyeball are supplied by the oculomotor nerve. We'll see that in detail. Okay. First, the oculomotor nerve is starting from the midbrain. So we'll see how it is going to arise from the midbrain. First, let's draw the midbrain at the level of superior colliculus. So this is the section of midbrain at the level of superior colliculus. So this is superior colliculus. This is superior colliculus. So here we have the aqueduct. The aqueduct is there. On either side of the aqueduct, on the anterior aspect, we have a motor nucleus of the trigeminal nerve. Okay, these two are the motor nuclear complex because both the nucleus are united in the midline. So this is called the motor nucleus of the trigeminal nerve, motor nuclear complex. We can call it as motor nuclear complex. Lateral to the motor nuclear complex, we have the Edinger-Westphal nucleus. Lateral to it, we have the Edinger-Westphal nucleus. Edinger-Westphal nucleus. Okay, this Edinger-Westphal nucleus will be relaying in the ciliary ganglia, and the postganglionic fibers, which are parasympathetic, will be supplying the ciliaris and the sphincter pupillae. So this is also motor fibers. Okay, these parasympathetic fibers which are coming from the Edinger-Westphal nucleus is also motor fibers which are going to supply the sphincter pupillae and the ciliaris muscle. So that is why this oculomotor nerve is actually entirely motor. Okay, there is no sensory component, it's entirely motor. So when we talk about the functional components, we have to tell about the two nucleus, which are the motor and the Edinger-Westphal nucleus. The motor nucleus are present anterior to the aqueduct and it forms a motor nuclear complex. Both of the nucleus together forms a motor nuclear complex. And the Edinger-Westphal nucleus, which is present lateral to the motor nucleus, which is going to carry the parasympathetic fibers, which are going to supply the ciliaris and the sphincter pupillae. So these motor fibers are going to supply the extraocular muscles. So which all extraocular muscles? So there are 4 recti. Out of the 4 recti, only the lateral rectus is not supplied by the oculomotor nerve. Okay, the lateral rectus is supplied by the 6th cranial nerve, the abducens nerve. 6th cranial nerve is the abducens nerve. Other than that, we have 2 obliques, the superior oblique and the inferior oblique. The superior oblique is not supplied by the oculomotor nerve. The superior oblique is actually supplied by the 4th cranial nerve. Okay, that is the trochlear nerve. Then we have one more muscle, that is the levator palpebrae superioris, that is also supplied by the oculomotor nerve. Okay, levator palpebrae superior, which is going to elevate the eyelid, Now we will see the course of the nerve. So when we talk about the course, initially the nerve is present inside the substance of the midbrain. Okay, and it travels anteriorly. Then it emerges out of the midbrain through the anteromedial aspect of this crus cerebri. Okay, anteromedial aspect of the crus cerebri. Then it travels forwards. When it travels forwards, it is present in the subarachnoid space. It is still present inside the subarachnoid space. Here it is related to the 2 blood vessels. Okay, which are passing. One is passing superior to it and one is passing inferior to it. So this is the posterior cerebral artery which will be passing superior to the nerve, and inferior to the nerve is one more artery, that is the inferior to the nerve. One more artery which will be passing, that is the superior cerebellar artery. So this is So the nerve which is passing the artery which is passing inferior to the nerve is the superior cerebellar artery, and this one is posterior cerebral artery. Okay. Now the nerve passes further laterally. Okay, now further laterally, here we have to draw some bones to describe the course. So this is actually the posterior clinoid process, and this one is actually the anterior clinoid process. Between that we have the cella turcica, and anterior clinoid, lateral to the anterior clinoid process we have the optic canal. This is actually the optic canal. Then laterally, still more laterally, we have a larger foramen which is the superior orbital fissure. So this is actually the superior orbital fissure. Okay, we can see this is the optic canal, and we can draw the superior orbital fissure like this here. Okay, superior orbital fissure. Now we have to draw one more dura. Now this is the dura mater. This is the dura mater. We have an attached part and the free part of the dura mater. So there is a triangular interval between the attached and the free part of the dura mater. This triangular interval. Okay, there is between the attached and the free part of the dura, there is a triangular interval. So this fold of dura is the tentorium. Okay, this is actually the tentorium cerebelli. Okay, so this is having an attached part and a free part. Between that we have the fold of dura mater. So now after the nerve is related to these two arteries, it will first pierce the arachnoid mater. Okay, first it will pierce the arachnoid mater, then it travels laterally, then it will pierce the dura mater in the between the attached and the free border of the tentorium. Between the attached and the free part of the tentorium, it pierces the dura mater to emerge out, and it will be related to the lateral aspect of the sinus, which is related here. Okay, we'll study all those things in the bone. So this is the place which we have drawn here. Okay, so this is the place, actually this is the place which we have drawn here. Okay, so here this is the optic canal which we have drawn here, and this is the superior orbital fissure. This is the superior orbital fissure which we have represented here. Okay, so here will be the dura which will be attached here, that is the tentorium. So here the nerve pierces here, and it will be related to the cavernous sinus which is located here. Okay, it will be related to the lateral wall of the cavernous sinus. So this is the location of cavernous sinus. So location of cavernous sinus, and the nerve is related lateral to the cavernous sinus. Okay, the nerve is related lateral to the cavernous sinus. Next, we need to know about some of the feature of this superior orbital fissure. The superior orbital fissure, we can see there is a tendinous ring which is related to the superior orbital fissure, from where all the recti muscles of the eyeball will be taking origin. Okay, all the recti muscles of the eyeball will be taking origin from. Okay, so we have the tendinous ring is related both to the superior orbital fissure, and there is a part medial to it. From the part medial to it, we have the optic nerve which will be emerging there. Okay, so that is actually the optic nerve. Okay, that is actually the optic nerve which will be emerging through that part. Next, through the superior orbital fissure which is related to the tendinous ring, this oculomotor nerve divides into two branches. This oculomotor nerve divides into two branches, that is the superior and the inferior. Two ramus, okay, superior ramus and the inferior ramus. Oculomotor nerve is going to divide into superior ramus and inferior ramus, then enter inside the superior orbital fissure. Now it has reached the superior orbital fissure. Once it reaches the superior orbit, it has to enter inside the eyeball. It has to enter inside the orbit. It has to enter inside the orbit. Now we will study the course and branches inside the orbit. Now we are going to study about the branches. To study about the branches, first we will draw the orbital wall. Okay, so there is a medial orbital wall and we have the lateral orbital wall. Okay, next we can draw the muscles. Okay, so the most superficial most muscle what you see will be the levator palpebrae superioris. So we can cut a part of the levator palpebrae superioris. Okay, that is actually the levator palpebrae superioris. Immediately below the levator palpebrae superioris, we have the next muscle, that is actually the superior rectus muscle. So that is actually the superior rectus and its insertion. That is the superior rectus muscle. Okay, immediately below it. Next, so this is actually the cut part of the levator palpebrae superioris, LPS, levator palpebrae. This is the superior rectus, and so superior rectus is below the levator palpebrae, situated below the levator palpebrae superior. So this also will cut it here. Okay. So next we can draw the lateral most muscle, that is the lateral rectus, which will be starting from the tendinous ring and will be inserted into the lateral aspect of the eyeball. So that is the lateral rectus. Then medially, the superficial most muscle will be the superior oblique. So we can draw part of the superior oblique. We can draw the part of the superior oblique. This is superior oblique which will take a turn here and then gets inserted into the eyeball. Okay. So it is actually taking a turn at a tendinous ring here, that is actually the trochlea. Okay, that is actually the trochlea. So this muscle is superior oblique. Similarly, we have one more muscle which is inferior oblique, which is placed under below the eyeball, and we can only see a part of it here, which will be coming here. It will be taking origin from the maxilla, so we can see only the part of it here. This is the inferior oblique. So this is actually the inferior oblique. Okay, this muscle is the inferior oblique. Now we can relatively draw the eyeball. We'll draw eyeball using a lighter shade so that all the muscles can be seen clearly. So that is actually the eyeball. This is the eyeball. Okay, we can cut the anterior part of the eyeball so that we can study the parasympathetic supply which is coming from. So this is actually the cut part of the anterior aspect of the eyeball. So we can see the interior of the eyeball here. So this is actually the cornea, the sclera. Now we have this is the iris and this is the ciliary body. So similarly we have the iris and the ciliary body this side. Okay. So these are the muscles of the iris and the ciliary body. Next we have to draw one more muscle which is present at the depth, that is the inferior rectus muscle. So this is actually the inferior rectus. Okay, this is actually the inferior rectus which is present here, which is taking origin from here. This is the inferior rectus. Inferior rectus. Now we'll study the branches of the nerve and how it supplies the muscles. Okay, out of this, the lateral rectus is not supplied by this nerve, and the superior oblique is not supplied by this nerve. So rest of the muscles are all supplied by the oculomotor nerve. We will study how it supplies. So we are going to study how it is going to supply. So this is actually the superior ramus and this is actually the inferior ramus. Okay, superior ramus we will represent with green color itself. The superior ramus will pass through the superior orbital fissure and it gives branches to the levator palpebrae superioris and the superior rectus. Okay, it gives branches to levator palpebrae superioris and the inferior rectus. So superior ramus is supplying levator palpebrae superioris and the superior rectus. Okay, that is about superior ramus. Next, coming to the inferior ramus we will represent using brown color. Okay, the inferior ramus will give branch to the inferior oblique give branch to inferior oblique, give branch to the inferior oblique, then it gives branch to the inferior rectus and the medial rectus. I didn't draw the medial rectus here, so this is actually the medial rectus. I can draw it here, which is getting inserted here. This is also taking origin from the tendinous ring. This is the medial rectus. So it's passing deep to all these structures to supply the medial rectus. Okay, so it is supplying the medial rectus, it is supplying the inferior rectus, and it is supplying the inferior oblique. So we can describe here the inferior ramus supplies the inferior oblique, it is going to supply the inferior rectus, all are inferiorly placed, and the medial rectus. Medial rectus is also inferiorly placed because it is below the superior oblique. Okay, so all these deeper muscles are supplied by the inferior ramus of the oculomotor nerve. Okay, inferior ramus of the oculomotor nerve. Now we have to talk about the supply, that is the parasympathetic supply, which is coming from the Edinger-Westphal nucleus. Okay. From the Edinger-Westphal nucleus, the preganglionic fibers, we are representing using pink color. Preganglionic fibers pass through this oculomotor nerve itself, through the motor route of the nerve. Then it will go through this is actually the inferior ramus or the inferior division of the oculomotor nerve. So it will go via the inferior division of the oculomotor nerve. Here it is passing via the nerve which is supplying the inferior rectus, okay, through the branch which is going to supply the inferior rectus to relay in the ganglia, the ciliary ganglia. It is going to relay in the ciliary ganglia. So we will represent ciliary ganglia using blue color. So this is the ciliary ganglia. Okay, so it is getting relayed in the ciliary ganglia, and from the neurons of the ciliary ganglia, the postganglionic fibers will pass. The postganglionic fibers are arising from the ciliary ganglia. Postganglionic fibers will pass through the short ciliary nerves. So these are the short ciliary nerves. Okay, postganglionic fibers will pass through multiple short ciliary nerves, which will pierce the sclera, and it will go beneath the sclera, so between the sclera and the choroid, and it travels anteriorly to supply these muscles. Okay, supply the ciliaris and the sphincter pupillae. It is going to supply the ciliaris. Okay, it is going to see, it is passing via the short ciliary nerves, it is passing deep to the sclera to travel anteriorly to end by supplying the ciliaris and sphincter pupillae. And the sphincter pupillae. Okay. Okay. So this is about the parasympathetic fibers which are coming through the ciliary ganglia. Okay, so the parasympathetic, which is also motor in function. So this is about the entire oculomotor nerve. Next, we will study about the applied importance of the oculomotor nerve. When we talk about the applied importance of the oculomotor nerve, we can see the oculomotor nerve is supplying this levator palpebrae superioris. Okay, so paralysis of the oculomotor nerve can cause paralysis of levator palpebrae superioris. So the function of levator palpebrae superioris is to elevate the eyelid, upper eyelid. So if this is paralyzed, what will happen? There will be inability to open the eye completely. So it is called ptosis. So the condition, drooping of the eyelid. So there will be drooping of the upper eyelid. So this drooping of the upper eyelid is called ptosis. Okay, it is called ptosis. The first applied importance is ptosis. Okay. Next, it is supplying mainly the muscles which are causing the medial deviation and the inferior, you can see, and the inferior muscles. Okay, so we can see that it is supplying the medial rectus, it is going to supply the inferior rectus, superior rectus, it is going to supply the inferior oblique. Okay, only the lateral rectus, the lateral deviation muscle is not supplied. So when the muscles, then these muscles are damaged, when these muscles are damaged, what happens is there will be lateral squint. There will be lateral, the eye will be deviated laterally, the eye will be deviated laterally, and also the eyeball will be rotated downwards by the superior oblique. So there is unopposed action of superior oblique and the lateral rectus, which will cause mainly the lateral squint, laterally deviated eyeball, and also it will be rotated inferiorly. Okay, the laterally deviated eyeball can be otherwise called as lateral strabismus. Okay, it can be otherwise called as lateral strabismus or the external strabismus. It's called external strabismus. External strabismus. External. So this is the first applied importance, the second applied importance. So then imagine when there is a paralysis of the fibers which are coming from the Edinger-Westphal nucleus. So it is going to supply the parasympathetic fibers to ciliaris and sphincter pupillae. If this is paralyzed, the motor fibers to the ciliaris and the sphincter pupillae is paralyzed, it will cause a problem with the accommodation and light reflex. Okay, light reflex. So when the light is flashed here, the pupils has to constrict. Okay, so this constriction will not be happening, so that there will be fixed dilated pupil. There will be fixed dilated pupil because of the paralysis of ciliaris muscle. Okay, then also it will cause problem with the accommodation. That is, when an object is focused from a nearby place, when the object is brought towards the eyeball, the pupils has to constrict. So this constriction will not happen. Okay, that is the loss of accommodation reflex. So light reflex and the accommodation reflex will be lost. The pupil will be dilated and fixed. Okay, these are all about the oculomotor nerve. Its origin, course, branches, area supplied, and the applied importance. Thank you.